This morning, Thomas Eric Duncan was pronounced dead in Dallas, the first patient diagnosed with Ebola on U.S. soil, possibly not the last. Later today, a sheriff's deputy was reported ill and is being tested. Questions now swirl around how to guard against a killer disease that isn't airborne, but clearly travels. CBC's medical sciences correspondent Kelly Crow has more.
Late this afternoon, the U.S. headlines were once again flashing the Ebola alarm.
Tonight, breaking news, a second possible Ebola case.
With news that a Texas deputy sheriff might be infected. Even though the man does not have all the symptoms, and even though he did not have direct contact with Thomas Duncan, still he was in Duncan's apartment. And so he was taken to hospital with live TV crews in tow.
Right now, they're treating this as a low-risk event.
It's evidence of a country on edge, especially now that Thomas Duncan has died.
Despite maximal interventions, we learned today that he passed away.
Duncan's contacts are still being monitored. And today, U.S. officials announced new screening at the 5 U.S. airports that receive most of the passengers from West Africa. Anyone coming from an Ebola-affected country will be asked some questions and have their temperatures taken. In question period, Canada's health minister also announced a new screening measure.
Our government will be taking the additional step of doing targeted temperature screenings, but we'll do whatever is necessary to protect Canadians.
But with news that the outbreak in Africa is showing no signs of slowing down, the real work of containing the epidemic has to happen there. And with treatment centers overwhelmed and cases almost doubling every 3 weeks, the existing strategy of containment is not working.
Now, the scale of the outbreak is so huge, the thinking has moved on to we may not be able to get this done without vaccine.
Canadian press reporter Helen Branswell has reported on how the vaccine story has evolved over the course of this outbreak.
There were people who were kind of interested in just saying, if it's safe to use in people and we can figure out what a dose is, then let's just go. But there are others who are insisting that if you're going to use something widely, you have to make sure you're not going to be causing more problems than you're solving.
So it will be months before the vaccine is ready. The safety trials are only just getting underway, and then they have to be tested to see if they work. And there's not much vaccine around to do all that testing. And that means the 800 to 1,000 doses that Canada has donated to the WHO will probably be used up in those clinical trials. Wendy?
So there's Ottawa's announcement about airport screening. What does that mean? Will all travelers be screened?
Well, the border officials I talked to tonight in Vancouver and Toronto said they still hadn't heard from headquarters about exactly what was happening. But it seems that not much will change for the average passenger. Already, border officials were asking people who had come from Ebola-affected countries if they're feeling sick or if they've been around a sick person. And if they answered yes, they were being sent to a quarantine officer. So now that quarantine officer will actually take their temperature. That's what's changed.
Thanks so much, Kelly. Kelly Crow.